You've heard it a million times, right? Maybe you've even said it yourself. That feeling hits and you go, oh, I think I've got the flu. Or even worse, the dreaded stomach flu. We just toss these terms around, but what do they actually mean? And honestly, does the difference even matter?
So let's just get right down to it. Is there a real, meaningful difference between saying the flu and influenza? Or is this all just splitting hairs? Well, it turns out there are two really compelling sides to this whole argument, and we're going to break them both down. All right, first up, let's look at side A. This is the case for precision. The argument here is that when we're talking about our health, the words we use, they matter a lot. From this perspective, influenza isn't just a vague feeling of being sick. Nope. It is a very precise medical term for a specific family of respiratory viruses. We're talking about the ones that attack your nose, your throat, your lungs, and can sometimes lead to some really serious complications. And this is where the problem comes in, according to this side. The word flu has kind of become this catch-all for pretty much any minor illness. Really bad cold, people call it the flu. An upset stomach, suddenly it's the stomach flu, which, by the way, is usually gastroenteritis and has absolutely nothing to do with the influenza virus.
Now, this isn't just about being a stickler for words. This kind of confusion has real-world consequences. When we call every little bug the flu, we can start to really underestimate how dangerous actual influenza can be. That can lead people to incorrectly diagnose themselves and, maybe even worse, delay getting the proper medical care when they truly need it. So, for this side of the argument, it really all boils down to public health. During a major outbreak, clear and accurate communication is absolutely critical. Using the precise term influenza could help everyone understand the specific threat and know exactly how to respond. Okay, but that leads to a fantastic question, right? If influenza is the technically correct, superior term, why do we constantly hear the flu from the very people who should know better? We're talking doctors, news reporters, even the CDC.
And that question, well, it brings us perfectly to side B. This argument is all about the power of common, everyday language. This side says that in the real world, how people actually talk is what really matters most.
You see, the core of this argument is that language is always changing. For pretty much everyone, and that includes a lot of doctors in casual conversation, flu isn't a different illness. It's just the shorter, easier, and universally understood name for influenza.
And hey, it's not just us saying it. Official public health campaigns intentionally use the word flu. Why would they do that? Because they know that to reach the most people, you have to speak their language. It's that simple. I mean, just think about it for a second. Have you ever, in your life, heard someone talk about getting their influenza shot? Of course not. It's a flu shot. We have flu season. We have the flu vaccine. Using the word flu is just practical. It cuts through confusing jargon and makes sure the message lands loud and clear. So from this point of view, the problem isn't the word itself. The real challenge is making sure people understand what the illness is, a serious respiratory infection, no matter what you decide to call it. Okay, so who's right? The people who want precision or the people who want clear communication? Well, the real takeaway here isn't about picking a winner. It's about understanding the tension this whole debate reveals between science and how we talk about it. This really isn't a case of right versus wrong. It's more of a conflict between two valid and equally important goals. Side A champions medical accuracy because they want to prevent dangerous confusion. Side B champions clear communication because they want to reach as many people as possible. At the end of the day, both sides want the exact same thing, a healthier, better informed public. What this debate really shines a light on is this fundamental tension you see in all of science. How do you balance being technically precise with the need to communicate effectively with everyone? It is a constant balancing act, and just understanding that challenge is a huge part of being health literate. So we'll leave you with this little thought experiment. The next time you hear someone talk about flu season, or you go to get your flu shot, are you going to be thinking about the specific virus itself, or are you going to be thinking about the power and the pitfalls of the words we choose? It's definitely something to consider. Thanks for joining this explainer.